Now we're going to talk about the other antiviral medications that we have. First, we have acyclovir. Next, ganciclovir. Next, foscarnet. And lastly, cidofovir. So, first, in the activation of these drugs, there are two enzymes. Well, at least for these two, there are two enzymes. For this is one enzyme. First, here's the cell infected with a virus, could be a herpes virus, let's say. So, when the drug enters the cell, the viral kinase, thymidine kinase of the virus, phosphorylates the drugs, puts a phosphate. Then the host enzyme or host kinase 3-phosphate now this, so puts other two phosphates, and now this is a nucleoside analog that acts as a chain termination in the synthesis of DNA and RNA. So acyclovir is usually used mainly for herpes simplex virus and varicella zoster virus, but not specifically in the zoster phase. In the zoster phase, we preferentially give famciclovir. This acyclovir reduces the reactivation. So when the latent infection is, so just the reactivation, and it could also be helpful in chickenpox if you're given in not the beginning, and the acyclovir is not working in the latent phase of the virus. So first step, the drug enters the cell and is phosphorylated by the viral kinase. Second is triphosphated by the host kinase, and next inhibits the chain by inhibiting the DNA polymerase in this case, because we're talking about a DNA virus that is herpes simplex virus. And there is other formulation that is valciclovir. This is the same, just with better viability, oral viability. Ganciclovir is the same as acyclovir. Same, the enters the cell, the viral kinase phosphate this, then the host kinase 3-phosphate the drug and acts as a chain termination. The only difference is that ganciclovir is also effective against cytomegalovirus, because the cytomegalovirus, instead of having the viral kinase that puts the phosphate, has a viral phosphotransferase enzyme UL97, and it has the same activity as the viral kinase. So next, the host cell 3-phosphate the phosphated drug and acts as a chain termination. This is mainly used for a cytomegalovirus infection in HIV patients. The resistance is the same as for acyclovir resistance, that is, that the viral thymidine kinase mutates. If there is resistance to acyclovir, but in a way that is not because of mutation in the viral kinase, ganciclovir can be given. The other formulation is valganciclovir, that also has better viability. Next, for the adverse effect, I forgot. The adverse effect for ganciclovir is the same way that this acts as a chain termination of the DNA replication or synthesis of the viral, also to our cells, so produces leukopenia, thrombocytopenia, anemia, profound pancytopenia, sometimes crystalluria, rash, seizures. The most important here is the pancytopenia. And for acyclovir, the adverse effect is crystalluria, especially if the patient is not hydrated. So it's very important to hydrate the patient that is given acyclovir, and it is given IV, is more probable that the patient develops the crystalluria IV instead of oral, for example. Foscarnet do not need the first activation, do not need to be phosphorylated, but because foscarnet is already phosphorylated, but needs the triphosphate. Foscarnet is used in immunocompromised patients like HIV patients when there is resistance to ganciclovir. It's mainly used for retinitis. The adverse effect is extremely nephrotoxicity. It could be hypo or hypercalcemia, hypo or hyperphosphatemia, changes in the potassium and in magnesium. Also, the foscarnet, the adverse effect of the hypocalcemia can be potentiated if we give pentamine, because this also produces hypocalcemia, and so we should not do this, we should not give this combination. And lastly, cidofovir. Cidofovir, the same way as foscarnet, do not need the phosphorylation by the viral kinase. It acts by inhibiting the DNA polymerase, also by binding to the pyrophosphate group or site, and the adverse effect is nephrotoxicity, especially if given also with some other antibiotics, and this is also used for retinitis from cytomegalovirus in AIDS patients, but usually we first give foscarnet. So we have acyclovir, and ganciclovir, together with the nucleoside reverse transcriptase inhibitors. These first need to be phosphorylated by the viral thymidine kinase, next phosphorylated by the host kinase, and now we have the analog of the nucleosides and act as a chain termination. Foscarnet and cidofovir, they come here. Foscarnet and cidofovir, they do not need this step, that is the phosphation from the viral kinase. Foscarnet is also used in HIV patients. It helps to inhibit the synthesis of DNA from RNA. So inhibit this RNA-dependent DNA polymerase.